We're back. Dion Evans live, truth, raw, and uncut. Oftentimes I'm bringing into the Skype line Ijanea Camp, but oh no, not today. She's sitting right here next to me, slaving over a hot microphone alongside me. How you doing, Ijanea?
I'm good, Dion. How are you?
I'm doing great. I'm glad to be in your company today.
I'm glad I'm able to
You're
make
always
it.
looking quite radiant.
Oh, thank you.
Yeah.
You're too kind.
No, I'm just kind.
Thank you.
That wasn't too kind. It was kind.
Thank you.
I'm just, I'm not the only one. I'm not the only one. There are many men on Facebook who are jealous right now. They didn't have a problem when all it was, just talking to you over the cyberspace. But that I can reach over and touch your skin.
Oh, yeah.
Oh, yeah. That clean eating skin.
Oh, yeah.
Oh, yeah. That's what I'm talking about. Y'all don't be mad. At the second Saturday conversation, I told folks, I said, I am married. I sound like a cheater and that I'm not married, but I really am very happily married.
You are.
Well,
I know you are.
I know. I know you know.
Oh, I know.
What I'm talking about.
I know.
What I'm talking about. What we got going on today?
Well, I have a wonderful, let me just say this. I love Facebook because it allows me to interact and meet wonderful, like-minded people. And so I have been friends with Dr. Will Cole for a very short amount of time. I'm not even sure who introduced me to him, but when I started reading his post and learned about him, I was like, oh my gosh, this is a doctor who gets it. Mm-hmm. We speak common language in terms of the benefits of eating the right foods, alternative medicine. And I was like, I've got to get him on Dion Evans Live and just let your national audience listen and hear him and hear how beneficial it is to have a doctor like that in your corner. And so that's why I wanted to.
Well, let's not delay it.
Let's not delay it.
I think we got him on the Skype line. That's good stuff. Dr. Will Cole, are you there?
I am here, sir.
That is awesome. Here. That is awesome. We're glad to have you on Dion Evans Live, Truth, Raw, and Uncut. This is what I'm going to do. I'm just going to turn the mic over to Ijanea and let y'all have at it and let the rest of us just ear hustle.
I think we can handle it.
Go right ahead. Let's do it.
Yeah, we can handle it.
Well, thank you again, Dr. Cole, for agreeing to come on the show. As you know, I am one of your fans. And I was a little nervous to reach out to you because, you reach out to someone and you never know if they're going to reply. But he was very cordial and personal. And I just knew from watching your YouTube videos that you really have passion around helping people to be their best in terms of being healthy and, just all in all areas of life. And so if you don't mind, if you could just share with the listeners just a little bit about yourself and we'll just talk about your practice and how you got into this, et cetera, et cetera.
Of course. Thank you so much for having me on the show. I'm so excited to talk with everybody. Well, I am Dr. Cole. I see patients locally in the Pittsburgh, Pennsylvania area, but I'm blessed to have a virtual practice where I get to help patients optimize their health across the nation and across the country. So I specialize in a field of health called functional medicine, which is really the alternative medicine for the 21st century, where we're using the best labs out there to really look beyond the label of why people are sick and really finding out the root cause of why they're ill. And we're reversing disease. We're optimizing health. We're helping people regain energy that they never thought they would have. So I love coming to work every day because I get to allow patients to have the health that they want and kind of reclaim themselves that they feel like they never would have again.
Awesome. So tell us a little bit about functional medicine as well as how you got interested in functional medicine.
Yeah, well, just being in the clinic and seeing patients really suffer, I needed to find a new progressive way to really fill in the gap of, I've seen patients just have a laundry list of medications. The only thing that's changing in their life is their prescription list, and they're just getting more and more sick. We need to do something dramatically different for this dramatically failing model of care, and we're seeing quite the opposite in the virtual practice and in the clinics here. People reducing and eliminating their need for prescription medication. They're regaining energy, like I said, and they're just getting years back onto their life where, I hear time and time again patients saying, I was planning my funeral in the next couple years, but now I'm planning vacations with my family. And that's such a huge blessing to be able to be a part of it and really allowing the body to heal itself as it was intended to be. So functional medicine really fills in that gap in healthcare where you're dealing with chronic disease in the mainstream medicine. It's failing people dramatically. And to see the opposite happen in the clinic, it just needed to be done. And I'm glad that I was called to do it.
That is awesome. You know, I come into this clean eating lifestyle and looking at alternatives to medicine because of my own personal challenges with weight, as well as a variety of medical conditions. And I was just wondering, I'm not quite sure of the geographic area of Pittsburgh, but I assume based on a video that I saw of one of your clients, I believe his name is Ed, who experienced great weight loss. I was just wondering about the demographics of the, or even the racial, ethnicity, as well as the class of people that you see, and what medical problems that typically present themselves to you. Because Ed seemed like he did talk about he lost a lot of weight, but I can just imagine he had some other health problems that
Absolutely.
lessened.
Yeah, I mean, what's affecting Pittsburgh is affecting the Bay Area, and it's affecting the whole entire country because we're all in the same lifestyle, and it's killing us. We're dealing with 1 in 2 Americans are dying from heart attacks. 1 in 3 Americans are dying from cancer. And I mean, this is what we're seeing here, but this is what I'm seeing across the country in the virtual practice too, where patients are plagued by things like diabetes. And actually, Ed, you mentioned Ed, he was a type 2 diabetic, but he's been able to reverse his diabetes completely, where he's off not only his diabetic medication, but his high blood pressure, his high cholesterol medication, not because I'm a magician or not because there's any gimmick involved, but because we're dealing with healing at the seed level of why they're sick in the first place. And Ed and any type 2 diabetic is not diabetic because they have a medication deficiency, and they're not going to become less diabetic with more medication. So we're able to reverse that disease process, and it again is exciting stuff. And Ed and people like Ed are really seeing great results with functional medicine, what we're doing.
That is awesome. So how would someone, if someone in the Bay Area, for example, wanted to reach out to you, kind of walk through what that process would be in the virtual relationship?
Yeah, it's super easy with things like Skype and things like the Google chat. You can just go to drwillcole.com. That's drwillcole.com. It's really simple. You just look right on the page. You can set up a consultation, and I can see if I can help you or not. And it really is that first step where patients can, jump out of the box that they're in right now. They feel like there's no hope. They feel like just, their mom maybe had a disease or their dad did. They just feel like that's their lot in life. But, God called us to live an abundant life, I believe, and there's no reason, statistically based on the research and what we're seeing in the clinic, is that there's no reason why we cannot live 80 to 100 healthy, disease-free years in our life, and that's what we're seeing in the clinic here.
I just love Dr. Will Cole.
He's great. I mean, I'm totally digging the conversation.
I'm going to print out one of your pictures and put it on my wall like a poster. He's married. He's very happily married. I'm not flirting. I'm just saying it is important for us, all of us, not just African Americans, to reach out to people who are there to help and to assist us. And so, again, this is another reason why I wanted to have Dr. Will Cole on. He knows his stuff. He's helping people, and it's just important that even people who take my information to know that I'm not just pulling information from somewhere. This exists. You can heal your body through having the right foods. There are alternatives to medicine. You can reduce symptoms of a variety of different medical conditions, even those that are affecting your immune system. You can do so and even reverse, just as he mentioned, diabetes and things like that. So I just definitely want people to know that we have to seek out help, and we have to be open, because as he mentioned, this current model of healthcare is killing us. all the big pharma companies want to do. It's big business. That's how I feel. It's big business. And when we get enough information, we will be empowered to use it. And so I just really want, if people are out there, you want to ask questions of Dr. Cole, of myself, please feel free to call in. The number is 510-251-1274. You can also ask questions on Dion's post, or even my own, page on Facebook, or my own page on Facebook, as well as Dr. Cole's. Be sure to find him on Facebook and become his friend, as well as go to his website, as he mentioned. So, Dr. Cole, I wanted to talk to you. There's another video that I saw of yours that talked about, let's see, which one was it? Maybe it was about metabolic syndrome. Did you do a video on that? Or can you talk about that, what that is?
Yeah. I mean, metabolic syndrome, again, is one of those things that is plaguing Americans. They feel fatigued, they have brain fog, or just no matter what they do, they can't lose weight. And they could live at the gym or do all the fad diets they want, but their best luck is losing a few pounds here and there. Well, there's a reason why you're going through that. And it's not because you're a bad person. It's not because it's out of your control at some point. And metabolic syndrome is one of those issues where you have to deal with the underlying cellular inflammation, hormonal imbalance, whatever the case may be. It differs from patient to patient. But when we find out what is unique to you, because we're all created differently, what's unique to you, we customize and tailor a program down to their genetics, down to their physiology, to be able to, again, reverse that disease process. So yeah, metabolic syndrome, things like type 2 diabetes, insulin resistance, we see it a lot. And there's no reason why people have to be living in bondage to these chronic diseases.
Thank you very, very much. Dion, did you want to ask Dr. Cole a question?
Yeah, I want to know, how do you get rid of belly fat?
Belly fat it's a pain for people. And when you deal with these issues, these hormonal resistances, these toxicity issues, you can lose belly fat rather easily. We're seeing it happen all the time here at the clinic.
Let me ask this question. We got one of our listeners has IM'd in. They have a question for you. Is there one thing an asthmatic can do to cut the inflammation in the body?
Absolutely. Just a simple thing to decrease inflammation is just cut out the sugar. We hear it a lot, but you need to cut out refined sugar, processed sugar, but also people don't think of this very often, but grains, not only white grains, white breads, but all grains, especially grains that have gluten in them. It causes an immune response in the body that causes inflammation that any asthmatic or anybody that's dealing with chronic issues should not be consuming these foods, because it's making the problem worse. It's not making it better.
All right, I got another question for you, Doctor. Again, we have Dr. Will Cole. He's a special guest on Dion Evans Live, Truth, Raw, and Uncut. He is here on behalf of Ejanae Kant. She is always our segment 4 guest on Tuesdays. You can call in and ask the doctor some questions, 510-251-1274. Dr. Will.
Yes.
I have been athletic my whole life until I got married. I'm used to being buff, lifting weights. But as of late, when I start taking pictures like with a T-shirt on, I'll use the word disgusted, because my chest doesn't look like my chest in the photo.
Right.
You know where I'm going?
I know where you're going.
I don't have man boobs, but I look like I do. How do you get back that, buff look instead of that Buffy look?
that's Buff versus Buffy. I like that.
Well, how would you say your diet is? Would you say it's a good diet, great diet? What are you eating?
My diet is better because Ejanae has been on me for a year. So there's a lot of things I've cut out completely. And I have been a more smarter eater in the last year than ever. Let me put it to you like this. It's almost been 9-10 months since my car tires have been on the grounds of a McDonald's.
Woohoo!
Wow.
That's the first time in my life.
That is great.
Yeah.
That's exciting. diet is I would say 90% of it. You have to eat a clean diet. There's no way around it. But another effective, easy, quick way to burn belly fat and to tighten up your chest area is something called burst training or high intensity interval training. You can Google it, look it up online. It's really in the research out there right now. But it's one of those things where you run 90% capacity for 30 to 60 seconds, and then you take a break for about 2 minutes, you walk in between, and then you burst again. And you do that 3 to 5 times. It's been shown in the research to increase your growth hormone, increase all the anti-aging fat-burning hormones. So you do it in about 15 minutes, but it's been shown to be the most effective way at burning that stubborn fat.
Oh, that's good stuff. Yeah. So you do like when we were in college, we used to do this thing called jog the curves, run the straightaways.
Yeah, I mean that it sounds like the same thing. So you're running about 90% of what you can do for 30 to 60 seconds, and then you take those 2-minute breaks in between. But that what that does is your growth hormone, which is burning fat, and it's increased throughout that day that you did it and the next day. So you would do the burst training every other day. And the research is very clear. It's the best way at increasing growth hormone naturally and safely and really reversing that stubborn fat.
So that whole me trying to run a mile and working on getting my mile in a sub-6, that's ridiculous. I ought to do burst training. I'm on it.
Burst training. Get on it. Look it up.
I definitely do that when I train. Last night, I was running. I love to run outside, but I had to run inside. And so I have continuously picked up my speed and done and do, I should say, these intervals where I just run really, really, really fast for at least 30 seconds and then keep pushing myself. And the great thing is you get to see how well your lungs, you're able to breathe. You breathe in and you can be able to get your body to get that air throughout your body to the cells so they could use them and run. But it's very important to recover because even myself, I have to stop and start walking.
Yep.
Yeah. So that's really, really good.
Well, we're taking your website. We're taking your Facebook page because a lot of the people who are connected to RMG and connected to Dion Evans Live, I guess they learned about you through Ijanea, and they're now telling everybody they need to hook up with you. So I'm getting ready to hijack your Facebook page, drop it on my Facebook page so that people can get a hold of you. I really appreciate what you bring to the table.
Thank you, sir, for having me. I'm really blessed. Thank you.
All right. So I want to talk to you just a little bit about and of course you can't be totally specific, but when you do presentations or talk to people, and when you are talking about diet, I know that we all know, because I've been preaching to everybody who listens to this show about sugar and gluten and wheat and white flour and things like that. I also talk a lot about dairy and talk about the variety of different hormones, unfortunately, that's in it, and how that also can trigger various diseases, as well as, I would say like eczema and asthma and rashes and things like that, as well as for myself, I used to have chronic yeast infections because I had an overabundance of mucus in my body. And so I just wanted to know how you felt about dairy and what you see in your practice in terms of problems with dairy amongst children and adults. I'm actually not sure if you see children. Probably
I do.
Okay.
Yeah,
but if you could
do.
just talk about dairy a little bit.
Yeah, so dairy is one of those issues where you're right. The dairy that you're getting in the supermarket it's a dead food. It's just the sugar of the milk. It's been homogenized and pasteurized, and the cows are treated really poorly. It's not how God intended it. But, if you can get real organic milk, and if you can even get milk that's not so processed, it actually has a lot of benefits. And people that are normally having these immune responses to the regular factory farmed standard supermarket milk are not having the same reactions as you get when you get the good milk, the organic milk, the more natural milk, those they're less antigenic. It's less inflammatory in the body, but it's going to be down to the individual where, genetically somebody may have an immune response to milk and the other person may not. So it's really a case-by-case basis. But yes, the standard milk that you're getting in the supermarket should not be consumed. You're right about that.
Thank you. Thank you. We have a question from Trina Lomax. She wants to ask a question regarding flu symptoms and upper respiratory infections. And we're talking about alternatives to prescription drugs. So she'd like to know, what would you prescribe to someone who I'm assuming already has flu-like symptoms or upper respiratory infections?
Right. So just a basic advice for anybody that's their immune system's compromised is cut out the things that cause the immune to be compromised in the first place. So going back to the sugar thing, it's not popular to tell people they can't have sugar. They need to go off of that. They need to go off of the processed grains. They need to go off of the bad fats. So a lot of the canola oils and the vegetable oils and the corn oils and the soy oils, all of these oils again cause the immune system to be flared up. So you're going to have to go off of that. And then have just a wide variety of live foods, whole foods are going to help boost that immune system to help shorten that shelf life of those flu symptoms.
Do you have a brother?
Do I have a brother?
Who's single?
A single brother?
Who's just like you?
A twin.
A twin. Oh my God.
I don't.
All right. We'll talk about that later.
Facebook, I've been on air, Dr. Will. I've been on air 2 hours. This is the last half hour of the 2 hours, and the ladies have come out of the woodworks.
Oh.
They've been listening the whole time, but your voice and what you're talking about, yeah, they're like, Facebook is going off right now. It's good stuff. They're learning and they're yearning.
Oh, yeah.
That's right. Health is sexy.
I like that.
It is.
That should be a t-shirt.
And it should be contagious.
I'm going to tweet
right.
that.
Yeah, it should.
That's right. Health is sexy and contagious. That's right.
It is contagious. So we are coming down to the last
3 minutes.
About 3 minutes. So, Dr. Cole, what are some other important things that you want listeners to know? You definitely talked about sugar, processed foods, grains, and things that people should really, really eliminate, or if not anything else, reduce from their diet. But what are other things? Maybe you want to talk about sleep or water, environment, things like that to make sure people keep themselves healthy.
Well, I mean, diet is huge. Like I said, diet's about 90% of it. But, also the household products that we use, our makeup and the skin products that women use, the shampoos, a lot of these products have chemicals in them. So I would say educate yourself on the labels of these products. Look at the side effects of the chemicals that are in these products and what they can do to your health, because a lot of them are hormone disruptors, which again adds to that bucket that makes these toxic conditions to be really stubborn, and it's hard to regain health when we're inundating our body. And our skin's the biggest organ that we have. We're absorbing all of these toxins in our bloodstream.
Yeah, absolutely. That's good. Sorry, keep going.
No, I was going to say, yeah, so do you guys talk about that on the show? Because I do feel like that is an important topic.
I've just now started to dig into that. I had on my cover page recently a picture of a woman who was kind of bearing it all, but she had her face made up, and it pointed to the chemicals that were in her lotion, in her blush, in her lipstick, all those types of things, because it's really, really important to pay attention to that. I have become much more natural now as I've educated myself. And I do believe wholeheartedly that a lot of the hair that I had on my head and makeup and things like that contributed to a lot of my health problems. But I'm so much better now. So I appreciate you for saying that. But definitely household products have tons of chemicals in it, and that we don't get that we're inhaling these things. We're putting them on our hands. And as you said, right there in the skin, that's where we're going to absorb things and in our respiratory system. And we're hurting ourselves.
Yeah, absolutely. I mean, the statistic is since World War II, we have introduced over 80,000 chemicals in our life. 80,000. That's an insane amount of toxins where, not too long ago, it was just not in existence. And then that same time period, we're seeing a rise of all these chronic diseases. And it's all connected. It's all connected. And like you said about the standard model of care, it's profits over people. People really have to take their health in their own hands and take responsibility for it and regain it for themselves and reclaim it for themselves.
Awesome. 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 I am so happy that we had you on the show, and I definitely want to have you back, and I need to figure out how to get you as my primary care physician.
Virtually.
You got to move to Pittsburgh.
No. We're going to do it virtually.
Oh,
Virtually.
Somehow we're going to figure it out.
Oh,
It's the 21st century.
Yeah.
We got to get him. We got to get him on the broadcast more often.
Yeah.
Answer questions. Just let rapid fire. People have questions they want answered.
Dr. Cole and I have been talking
I'm here
about
for
that.
you.
I just wanted you to hear him so we can make
Oh,
that
I'm
happen.
sold.
Oh, good.
He's
All
on his
right.
stuff.
All right. I told you, Dr.
But I
Cole.
knew that. I knew that because I know you.
Oh, I love him.
I'm saying. Like I
Cool.
said, I trust you, so I know that you would only bring the best.
Absolutely.
And he knocked it out the park. I love it.
I love it.
Digging it.
Love it.
Do
Love
some burst later on.
it. Yeah.
Yeah, burst it.
That's what I'm talking about. I'm going to burst it.
My client is listening. That's what we're going to do tonight.
All right, you've been listening to Dion Evans Live Truth Raw and Uncut. Segment 4 with Ijanea Canton and Dr. Will Cole. Segment 3, we talked a little bit about Elmo. Segment 2, we talked about Abraham Shakespeare. Segment 3, yeah, it's going to happen in Pasadena at a Christian church. What's your thoughts? Dig in, dig out.
And once you dig in, you find your past.
You've been listening to Dion Evans Live, where truth is raw and uncut. Join us next time for more news, more relationship tips, and great conversation about sex with the Christian twist. Follow Dion Evans on Twitter at 4RMG or become Beautiful Chocolate's Facebook friend. Facebook.com/Dion Evans. Until next time, ta-ta.
And once you dig in,
The preceding opinions were not necessarily those of RMG Radio, its employees, or advertisers. Dion Evans Live is a production of the Religious Zine Media Group.